Many of us take prescription heartburn drugs, but a new study finds they are associated perhaps with an early death. WPTV medical expert Dr. David Soria is here with some of the information that we may need to know. First of all, what does this study find? Kind of take us through.
Yeah, well, it's always scary when you hear about this because you're talking about a very, very common medication.
Sure.
A lot of people take it. Now that it's over the counter, anytime the FDA approves something to be over the counter, you're assuming that it's pretty safe. So there's a little bit eye-opening because what they found was drugs like Prilosec and some of the others that are prescription, Nexium and so forth, actually were associated when they looked comparatively to other groups that weren't taking the drug. The ones that were, the patients that were, had a 25% increase in early risk of death. Now, what does that mean? I mean, it's hard to say what that means, but they define that as an early risk of death. Okay. So, I mean, the reality is that there's a few flaws with this study, and that is that, it's kind of like saying, if you're diabetic, and I look at a diabetic drug, and those who didn't take the diabetic drug, the ones that were, had an early risk of death. Well, of course, because diabetics have an earlier risk of death. They're sick people. They have disease. Same thing with heart disease. So, people with gastritis or heartburn or ulcers typically have disease, and that in and of itself can contribute to earlier problems and then, of course, death. And the fact also remains that older people use these drugs. So there's a few questions that remain before you can actually show a cause and effect with these drugs in an early death.
I want to get this right. Give us an example of a proton pump inhibitor, and then also maybe are there specific brands that we need to avoid?
So they didn't specify. All they did say was that they didn't look at the over-the-counter. They only looked at the prescription strength, but they're very similar. For example, Prilosec is now over-the-counter. Nexium is prescription strength. So there's a few, Prevacid. So there's a few that are still prescription versus over-the-counter, but as far as differentiating the two, there is none. They are all proton-pump inhibitors, which basically just decrease the amount of acid in your stomach. So there is no rhyme or reason. There isn't anything specific in this study that said this drug is safe and this drug is not.
Drug companies, what are they saying about this? Plans maybe to stop marketing some of these products?
Yeah, so a couple of the big companies have already came out and made some comments, and specifically to what I was speaking to before, that there is no cause and effect. It's way early. There's still a lot more research. So still
in the observational
You betcha. It's very observational because, again, these are sicker people. There is no real reason to be able to say, or real way to confidently tie the drug to early death. So we need to keep our eye on it. Is it, if you're on this medication, folks, is it something you need to go see your doctor or say, I got to stop it right away?
Just have the conversation.
Of course not. It's probably worth the conversation and have that discussion with your doctor, and just keep an eye out for this type of news.
All right, so don't toss out the heartburn drugs
just
yet. Dr. Soria, hope you had a great 4th. Nice to see you.